Or the heated health care debate, Minnesota Congresswoman Ilhan Omar, the latest lawmaker to support Medicare for all. She touted the controversial plan at a town hall meeting in her home state last night. Watch.
1 in 4 Americans cannot afford or access health care they need because of the prohibitive costs. This is unacceptable. It is a moral imperative that we fix it, and Medicare for all will do that.
Joining me right now in a First on Fox interview is MIT Ford professor of economics, the architect of Obamacare, one of the architects, and a former Treasury Department Deputy Assistant Secretary, Jonathan Gruber. Jonathan, it's good to see you again. Thanks so much for being here.
Good to be here, Maria.
Your reaction to what you just heard from Omar, it's prohibitive for most people in terms of the cost of health care.
Health insurance is really expensive for many Americans and unaffordable for many Americans. And it's a problem we need to solve. And we need to solve it in a way that recognizes that we can't allow insurance companies to discriminate against the sick. That's the fundamental goal that most Americans agree on. It sometimes goes by the name pre-existing conditions. But the bottom line is the main accomplishment of the Affordable Care Act was banning insurance market discrimination against the sick. We need to maintain that while expanding affordability so more people can get into insurance markets.
And yet, many markets saw prices and premiums go up after Obamacare was in place by double digits.
So in the first 3 years after Obamacare, before President Trump was elected, premiums went up on average 7% a year. They went up 0 the first 2 years and then 22% the third year.
Yeah, but in some markets, like you look at Arizona, you know, Jonathan, it was up, 25% or something. I mean, there were some, you're giving me an average, but there were some states that saw really prohibitive, very expensive premium increases.
Oh, absolutely. Yeah. I mean, any price varies, Maria. The key thing we want to focus on is the average.
Right.
The average was that the cost growth was much slower, about half of what it was before. President Trump, unfortunately, and the Republicans, by doing things like taking away the individual mandate and creating uncertainty in insurance markets, caused those premiums to go up a lot, but they've stabilized again.
You can't blame the Trump administration for premiums to go up, sure. Jonathan. They went up under Obamacare. Under Obama's plan, they went up.
Maria, as we discussed before, President Trump was elected. They went up 7% per year on average. They went up. Look, there's only two truths in the world, Maria.
But the administration didn't even do anything. They were continuing with Obamacare, and the premiums went up. But listen, I don't want to argue about what Obamacare was. Okay. I want to ask you really about Medicare for all. What do you think about Omar's answer? She says the only way this is going to get cured is Medicare for all.
I don't agree with that answer. I think that what is absolutely true is that the private market alone is not serving the interests of many Americans, and we need more expanded government involvement. That can take many forms. One form would be to build on what the Affordable Care Act accomplished, as Joe Biden recently suggested, by making premiums more affordable, by offering a public option to individuals, not a mandate, not forcing people to go into government insurance, but offering a public option, like towns have public parks. If you can't afford to have a backyard, you got a public park to go to. I think the same thing should be true with health insurance.
Yeah,
if you can't afford your private insurance, there should be a public option for you to go to.
The other thing is, in terms of Medicare for all, I mean, you're basically, doing away with the entire private insurance industry. 180 million people are getting their insurance from the private sector. So doing away with that, is actually creating Medicare for nobody.
Well, I mean, basically, that's not true. I mean, you are creating, I don't understand that line. You are creating Medicare for all. However, I completely agree with your main point, Maria, which is
you're not
Americans like
creating Medicare for all because it's a federal program that's going to do away with people's private insurance, 180 million people.
Sure. And it's going to put them in Medicare. And what I'm saying is I'm agreeing with your main point, which is that basically I think it's very difficult. You look at the opposition under Obamacare, the fact that a very small number of people had to give up really crappy health insurance, and they got very upset. You take that analogy to ask 180 million people to give up good health insurance, they're not going to be happy about it. Look, I think that we need to separate 2 points here. One point is that we need more government involvement to ensure that the broken health insurance market provides care for everyone. That doesn't mean Medicare for all necessarily, but it does mean more steps forward.
And I take issue with the whole idea of having a federal program, doing health care for everybody. I mean, why would I want some bureaucrat making decisions on my health care? If I'm able to get that MRI test, if I'm able to get the medicines that I want, maybe it's too expensive according to the government. That's the whole issue, having the government own that piece of my life.
Well, Maria, the government would not own that piece of your life if you didn't want that. People in Medicare, the government owns that piece of their life. They seem pretty happy with it. That's why Medicare for All's caught on, is because Medicare is so popular with the elderly. But I don't support that for everyone. I think that if you and I want a different health insurance plan that makes different choices than Medicare, we should have that option. But you and I can afford that option. The people in Florida and Texas who are below the poverty line and whose governors have committed the political malpractice of denying them free health insurance coverage, they don't have that option, Maria. It's either take a government plan or be uninsured.
So can you have a
government plan is
program
better than being uninsured.
Can you have a program then where you keep the private industry in place, 180 million people continue to get their health care the way they want to get it, but then for the others who need health care, you can do some kind of a program for those without messing with the large group of people who are getting their health care from private?
Look, Maria, as we know, anytime you do a massive public change, there will be some impact on the private market, but it will be minor. So if you look at Obamacare, that was a huge change, and yet employer-sponsored insurance continued to grow. Some people did have to change their plans. We'll admit that. But it's a very, very small number. So to answer your question, Maria, for the vast majority of people, and overall, if you put in a new public option, they could keep what they like. You can't promise, and I think it's a mistake to promise, that literally no one will be affected. But that's not the relevant question. The relevant question is if you can provide new health insurance for 30 million poor Americans, and a very small number of those with health insurance, for example, have to change the kind of plan they have, I think that's a price worth paying.
This all sounds like deja vu to me. In fact, Democratic frontrunner, former Vice President Joe Biden, making familiar promises now on the campaign plan that your former boss, President Obama, did. Watch this.
Anyone who has their employer-based health insurance they like, they can keep it.
You've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan.
Yeah, right. We know how that ended up, Jonathan. Democratic hopeful California Senator Kamala Harris also spoke out, assuring voters that they can keep their doctor under her plan. This is your first television interview reacting to the Democrats' health care plans, Jonathan. What's your reaction?
My reaction is that the statements they're making are saying that for the vast majority of people, this will not affect you. That was true for ObamaCare here in Massachusetts. That was true for Obamacare. For the vast majority of people, their lives were not touched by the law. Now, did that mean health insurance didn't change? No. Look, I remember going to the White House after Obamacare was passed, and President Obama's advisor said, look, we own the whole health care market now. Anything that changes, people are going to blame us for. And that's what happened. Most people whose health insurance changed, it wasn't because of Obamacare. It was because health insurance changes.
Well, it was because of Obamacare, because it was way too expensive, Jonathan. And not only that, but what it did to businesses was really worth noting. Because what it did to businesses is it increased the businesses' costs, and then they were facing these higher expenses, so they pulled back on money elsewhere. So for businesses,
Maria,
small businesses in particular, complained up and down the street about how expensive Obamacare was, Jonathan.
You may have heard complaints, and we've had this conversation before. But Maria, I urge you to look at the data. Since Obamacare was passed, since Obamacare was passed, the premiums employers pay for health insurance have grown at their slowest rate in measured history. Okay, that's what the data show you. That doesn't mean some employers didn't pay more. But look, Maria, before Obamacare, some employers paid more. In the 10 years before Obamacare, 10% of Americans lost their employer-sponsored health insurance. Was that Obamacare's fault? No. Things change in the health. Costs go up. Look, there's only two truths in America, Maria. Healthcare costs go up and baseball games take too long. Okay? And basically, health insurance costs were going up before Obamacare. They're going up after Obamacare. But they went up slower after Obamacare than they did before.
All right. We'll leave it there, Jonathan. Thanks so much. Jonathan Gruber.
Thank you so much for having me.
Joining us once again. Good to see you, sir. Thank you.